So today we'll discuss thanatology. There are many questions which comes from this topic. It is an extremely important topic in terms of forensic medicine. So we'll start. What is thanatology? Thanatology is the study of death. Okay, thanatology. The word thanatology has been derived from the word thanatos. It means the god of death. Means the god of death. Okay. Now, what is forensic thanatology? Okay. Forensic thanatology is the study of death from medico-legal point of view. So, we should know when and how did the person died. Okay. So, thanatology basically means the study of death, and forensic thanatology means study of death on the basis of medico-legal aspects to know when and how did the person died. Okay. So, what is the section in which death comes? Okay, so death comes under section 46 of Indian Penal Code. Okay, now Indian Penal Code has been changed to BNS. Okay, Bharatiya Nyaya Sahita. Okay, so now if the question examiners will ask in which sections the death comes or which sections define death. Okay, so now it is under section 2 of BNS and subsection 6 of 2 BNS. Death is being defined. Okay. Now, in recent examination, they asked about IPC only, but now in future, they can either ask from IPCs or they can ask from BNS. So, we have to be prepared in both the aspects. Okay. So, death is defined under subsection 6 of 2 BNS, whereas injury has been defined in subsection 14 of 2 BNS, and life has been defined under subsection 17 of 2 BNS. Now, what is injury? Just injury is any harm whatever illegally caused to a person, either to its body, mind, reputation and property. We'll discuss about injuries in forensic traumatology. So, I'll leave it here. Now, moving forward, what is taphonomy? Okay, taphonomy is the study of postmortem changes. Means the changes in body after death is taphonomy. These terminologies are important because sometimes they ask directly what is taphonomy, what is thanatology, etc., etc. Okay, so thanatology is study of death and taphonomy is the study of postmortem changes or the changes after death. Okay, now moving forward, what are the stages of death? What are the stages of death? So basically, what happens after death is an irreversible process. Okay, so there are stages of death in which, for example, first is a somatic death or a clinical death. After somatic death, we mostly declare person as dead and death certificates can be made. Okay, so our body contains about 60 trillion cells. Okay, and in 60 trillion cells, brain contain about 20 billion cells. Okay, so even after brain stem death, many cells in our body remains alive. Okay, so brain stem death or brain death is considered as somatic death, and all the cells which remain alive after the brain stem death, they will die after somatic, and they are known as molecular death. Okay, so what is somatic death or clinical death? It is a complete and irreversible stoppage of any Bishop's tripod of life component, which includes heart, that is circulation, lungs, that is respiration, brain functions. Okay, so this was the old traditional concept of somatic death. Now the modern concept says that somatic death coincides with the death of brain stem involving complete and irreversible stoppage of vital brain functions. So earlier it was considering all the points in Bishop triads: circulation, respiration and brain stem, brain death. Now according to modern concept, somatic death is the death of brainstem, which involves complete and irreversible stoppage of vital functions of brain. So, this you have to remember, and this you have to remember. They both are questions in exam. Okay. So, what are the cells which remains alive there even after the death of brain? Okay. So, there is peripheral nerve cells which dies within 5 minutes of somatic death. Okay. Then skeletal muscle cells which responds to electrical and mechanical stimuli up to 2 to 3 hours. Okay. Now, pupil will react with atropine or adrenaline or pilocarpine and physostigmine. With atropine, pupil will dilate, and with pilocarpine and physostigmine, pupil will constrict. This will happen even after death of brain also. Okay. But legally, a person is dead when somatic death has occurred. Death certificates can be issued. So, if examiner asks when you can issue death certificates, options can be somatic death, molecular death, or whatever. So, you have to mark answer as somatic death. After somatic death or brain death, if the patient is declared brain dead, you can issue death certificates. Okay. Moving forward. Now, after somatic death, what is molecular death? Molecular death is basically cellular death. Okay. Death of all the cells of the body. Now, it occurs 2 to 3 hours after somatic death. So, there will be somatic death first, then there will be molecular death. Okay, 2 to 3 hours. So, it will take around 2 to 3 hours from somatic death to molecular death. Okay. Now, as I said, what is molecular death? It is the death of all individual cells of the body. Death of all individual cells of the body. Now, there is a time gap of 2 to 3 hours between somatic and molecular death. Now, what is this period known as? This period is known as supravital period. Supravital period. This is a very important question. This period is known as supravital period. It is a time gap between somatic and molecular death. Okay. Now, why this period is important from a medical point of view is, it is important for human organ transplantation. Okay. Organs which have to be transplanted, they have to be retrieved from dead within this period only. Okay. Supravital period is a time gap between somatic death and molecular death, and important for human organ transplantation. If there is a body from which the organs have to be transplanted, then this is the vital period in which you have to retrieve the organ. Okay. And it is a question. So, if there is an injury when a person is live, it is known as ante-mortem injury. If there is a injury over the body after death, it is post-mortem injuries or post-mortem wound. Now, if there is an injury during supravital period, it is known as perimortem injury. It is known as perimortem injury or perimortem wound. Okay. So, now we will see the organs which we have to transplant, how much time we have from taking out the organ till transplantation. So, we have to take liver within 15 minutes. Okay. Kidney within 45 minutes, heart within 1 hour, and cornea within 3 hours of death. Okay. And these are also important points which can be asked in question. Okay. So, supravital period. In supravital period, you will take out organ for transplantation. Now, if we consider liver, we have time of 15 minutes. Okay. Kidney 45 minutes, heart 1 hour, and cornea 3 hours. Okay. So, what is brain death? Brain death. In brain death, we will study about 3 important criterias. or 3 important protocols. Okay, first is Harvard criteria, second is Philadelphia criteria protocol, third is Minnesota criteria. Okay, these 3 criterias are very important, and many a times many questions have been asked from this topic. So this topic you have to learn by heart. Okay, brain death. So coming to what is Harvard's criteria. Harvard's criteria was given in 1968. Now, it contained 5 important points. You have to just learn 5 important points. The first point is unreceptivity and unresponsivity of the brain. Okay, even with the most painful stimuli, that is reception, the person won't be able to react anything. Okay, even with the most painful stimuli, person produces no vocal or other responses. Okay, so this is unreceptivity and unresponsivity. If there is unreceptivity and unresponsivity, we will consider it as one of the point of brain death according to Harvard's criteria. Now, what is the second point? No movements or breathing. There should be no spontaneous muscular movements or breathing movements for at least 1 hour. Now, this is a very important point. This is a very important point for 1 hour. So, there should be no movements of any muscles or breathing for at least 1 hour. Okay. Now, one more important point, breathing movements. If the person is on ventilator or respirator, we have to observe breathing movement by turning off the respirator for 3 minutes. Okay. Now, third point is loss of reflexes. Okay. Pupils will be fixed and dilated. Ocular reflex will be lost. Corneal and phalangeal reflex will be lost. Spinal reflex will be lost. Okay. So, there will be loss of reflexes. Now, there will be isoelectric EEG, that is flat EEG we will see. We will repeat all these tests after 24 hour. After 24 hour, we will repeat all these tests. This is a question. And during the repetition, the respirator should be put back on. Okay. Respirator should be put back on. So, this was the Harvard's criteria of brain death. Okay. Now, let us recall what is the first point? Unreceptivity and unresponsibility. To the most painful stimuli, the person will not respond either vocally or with any other responses. Second is no movement or breathing. There will be no movement or breathing after turning off the respirator for at least 3 minutes. Then third point is loss of reflexes. There will be loss of reflexes. Then fourth is isoelectric EEG. There will be a flat line in EEG. Fifth is we have to repeat all these operations and all these tests after 24 hours, and during this period we have to turn on the respirator. Now, moving forward to Philadelphia Protocol. Okay, this was given in 1969. Okay, now first point is almost similar to the Harvard's criteria, lack of responsiveness to internal and external stimuli. Lack of responsiveness to internal and external stimuli. What is the second point? Second point is absence of breathing movements for 3 minutes. Okay. But the important point to note down here is in absence of hypercarbia, and while breathing in room air. Okay. While breathing in room air. So, there will be lack of responsiveness to external and internal stimuli. Second point is absence of breathing movement for 3 minutes in absence of first hypercarbia, and second is the person is breathing in, should be breathing in room air. Okay. Now, third point is no muscular movements, no muscular movement whatsoever. Okay. Fourth is loss of all reflexes. There will be loss of all reflexes. Fifth is falling arterial pressure without support of drugs. Okay. If there is falling arterial pressure without support of drugs, we'll consider it as a point of brain death. Sixth is flat EEG. Seventh is we will repeat the test after 2 hours. After 2 hours. In Harvard's criteria, we were repeating test after 24 hours. In Philadelphia, we will repeat the test after 2 hours. After 2 hours. And other point of difference is respirator is put off during 2 sets. Okay. In Harvard's, we were putting on the respirator when we were repeating the test, but in okay Philadelphia, the respirator is put off. Okay. Now, there is one more important point here is certification by 2 physician is required other than the physician of a potential organ transplant. One will be the person who is there for organ transplant, and there will be one more physician. In presence of both of them, certification will be done that the person is brain dead. Okay. So, this is also a very important point. How many physicians required? 2 physicians are required. Now, moving forward. Now, this one is a Minnesota criteria. Okay. Now, Harvard's and Philadelphia criteria and protocol respectively, they were for brain, full brain, okay, the whole brain death. Now, Minnesota criteria is for brain stem death, okay. So, there can be a question where they will confuse you by giving what are the criterias or protocol for brain stem death, and they'll give you all option Harvard, Philadelphia, Minnesota and Sydney, whatever. Okay, there is one declaration of Sydney I will discuss after some time or in some other topic. So, or they can give you all of the above. Now, mostly what we will go for in the panicness of exam, we will just tick all of the above because we know brain dead. Okay, I have learned about Harvard's, I have learned about Philadelphia, and I have learned about this Minnesota. So the answer is all of the above. No, if they are asking you about brainstem death, the answer will be Minnesota. Okay, the answer will be Minnesota. So okay, so what is Minnesota criteria? What is Minnesota criteria? It is for the brainstem death. The first point is very common, no spontaneous movement. There will be no spontaneous movement. Second will be no respiration for a period of 4 minutes. This is the question. No respiration for a period of 4 minutes. 4 minutes. Remember 4 minutes. Okay. Third is absence of 5 major brain stem reflexes. There will be absence of 5 major brain stem reflexes. First is there will be no pupillary response to light. There will be no pupillary response to light. The pupils will not react to light at all. Okay. Second will be no corneal reflex. No corneal reflex. No corneal reflexes will be there. Third will be vestibulo-ocular reflex will be absent. Vestibulo-ocular reflex will be absent. Okay. Fourth will be no ciliospinal reflexes will be there. What is ciliospinal reflexes? Whenever there is a painful stimuli given to face or neck or upper trunk, there will be dilatation of bilateral pupil. Okay, but they will be absent in brainstem death. So, last and fifth one will be there will be no gag reflex. So, there will be no pupillary reflex to light. There will be no corneal reflex. There will be no ciliospinal reflex, there will be no vestibulo-ocular reflex, and fifth one will be there will be no gag reflex. Okay. Now, fourth is EEG is not mandatory in Minnesota. EEG is not mandatory in Minnesota criteria. Is not mandatory in Minnesota. This is a question. This is a question. Now, all these tests will be repeated after 12 hours. Okay. Harvard's में it was 24 hours, Philadelphia में it was 2 and Minnesota में it was 12 hours. Okay. Okay. Now moving forward. Talking about the Indian scenario, in India, brainstem death is accepted as death. Okay. In India, if there is a person with brainstem death, it will be considered death. Okay. Now, as per Human Organ Transplantation Act of 1994, the removal of organ should happen only after brainstem death. Only after brainstem death. Before that, you cannot uh, even touch the organs for transplantation. Okay. So, as per Human Organ Transplant Act of 1994, the removal of organ will only be done after stem cell death. Now, this stem cell death will be declared by a panel of 4 doctors. Okay. First one will be obvious, will be the treating doctor. Okay. Second one will be the doctor who is the in charge of the hospital. Third will be neurophysician or neurosurgeon, which will be appointed by the in charge of that hospital. And fourth one will be an independent medical practitioner. Okay. So remember this point. Okay. Moving forward. Okay. So in brainstem death, what all criteria we have seen? Harvard, Philadelphia, Minnesota. And in Indian scenario, there is an Organ Transplantation Act of 1994 in which the organ transplant can only be done after the brainstem death of the person. 4 doctors panel is required: treating doctor, doctor in charge, neurophysician, surgeon, or independent RMP. So now moving forward, we'll see Bichet's mode of death. Okay. Now sometimes they ask question and we get confused between Bishop and Bichet's. What is Bichet's? Bichet's is the dysfunction or not functioning of 3 main parts or 3 main system of our body. Okay. If there is a dysfunction or non-functioning of respiratory system, it leads to asphyxia. So asphyxia is one of the mode of death. Then other one is syncope, if there is dysfunction of circulation, and if there is dysfunction of brain, it is coma. Okay. What is atria mortis or gateway of death? Okay. Atria mortis or gateway of death is stopping of only one component of Bichet's tripod of life, that is respiration, circulation, or brain function, resulting in death. It is almost like somatic death. It is an example of somatic death basically. So if there is stopping of any of the component of the Bichet's tripod, like respiration, circulation, or brain function, and which results in death, is atria mortis, or also known as gateway of death. It is an example of somatic death. Now, many questions have been asked previously and will be asked in future from this topic, that is suspended animation or apparent death. Okay, suspended animation or apparent death. What is suspended animation? It is a state when heartbeat and respiration of a person become so weak that it cannot be detected by any routine clinical methods. Okay, it is a state when the any clinical routine methods will not detect the heart rate or respiration of a person, and it will be given as or declared as death. Okay, now person may appear clinically dead, but he is not, because brain stem is functioning. So according to the definition of somatic death in modern concept, the person is death only when the brain stem function stops or brain function stops. So in definition of suspended animation, it says it is a state when where heart and respiration of a person becomes so weak then they cannot be detected in clinical routine methods, but the person cannot be declared that in such condition, because brain is functioning now. Brain is functioning. So what are the conditions in which we will see suspended animation? Suspended animation will be seen in prolonged anesthesia A, in newborn mein it is very common. It is very common in newborn. Barbiturate poisoning B, we will see in some conditions like cholera, cachexia, that is cachexic conditions mainly seen in immunocompromised patients like cancers and all. Concussion. Then we can see such a condition in drowning also. Okay. We can see in electrocution. We can see In hypothermia, that is person is in frozen state, hypothermia or hyperthermia, sunstroke, shock, insanity. Okay. Now, voluntarily suspended animation is seen in yoga practitioners. Okay, they call it as trance state. They can voluntarily go in such a state where they can stop their breathing and respiration for like couple of minutes or something. So now in typhoid or enteric fever also you'll see this suspended animation and morphine overdose. So A for anesthesia. In prolonged anesthesia, you will see suspended animation. Then B for barbiturate. In barbiturate, you will see suspended animation. C for cholera, cachexia, and concussion. You will see suspended animation. D, drowning. You will see suspended animation. E, electrocution. F, in frozen state, like in hypothermia, you will see. Then hyperthermia also you will see. Hyperthermia also contains sunstroke or heat stroke. Okay. Then comes in insanity. You will see suspended animation. Yoga practitioners and all, they can voluntarily go in a state of trance, which is also a suspended animation. Then in typhoid and in morphine overdose, you will see suspended animation. Now there is one interesting syndrome, Lazarus syndrome. Okay, they may ask question on this. What is Lazarus syndrome? Person coming back to life after having apparently death. This is a Lazarus syndrome. Just remember the name and what is the definition. Okay, you can get a question. So moving forward from suspended animation to, there are some tests which nowadays we don't use, but sometimes in exams they can ask you questions about them. How to confirm or how to diagnose death. Okay, so there are some tests to confirm death, like to confirm circulation or to confirm respiration. If you want to confirm circulation, there are three tests which we normally study. Is first is diaphanous test, second is Icard's test, and third is Magnus test. So what is diaphanous test? Diaphanous test is on transsimulation. When you give a light on fingers, there will be no redness in the web space between the fingers. Just remember the name and remember the test, means how it is done. So diaphanous test is to confirm circulation, and on trans illumination there will be no redness in the web space or between the fingers. Now what is Icard's test? Icard's test says there will be no discoloration on distal part of the finger on injecting fluorescent dye. Since there will be no viable circulation, so there will be no discoloration due to fluorescent dye. So you just remember the name Icard's test. Icard's test is related to confirm circulation, and there will be no discoloration of distal end of the fingers on injecting fluorescent dye in Icard test. Now what is Magnus test? Magnus test says there will be no congestion in the distal part of finger on applying ligature. Okay, normally if you apply tightly apply ligature or anything on your fingers, there will be congestion on the tip or the distal end of the fingers. But if there is no circulation, then it won't be happening. Okay, so in Magnus test, there will be no congestion of distal part of fingers on applying ligature. So there are three tests to confirm circulation. One is diaphanous test, second is Icard's test, and third is Magnus test. Now moving forward, now how will you confirm respiration? Now for them, that also there are three tests: Winslow's test, feather test, and mirror test. So what does Winslow's test says? If you put a bowl of water on the chest, then normally there will be movements in the water. Okay, as there is breathing and your respiratory muscles are working. But if a person is dead, then there will be no movement of bowel. So what is the procedure in Winslow's test? You have to put a bowl of water on the chest and then look for the movement of the bowel. Okay. Now second one is feathers test. Okay, feather kept in front of nose, and we have to look for the movement of the feather. Okay, if it is there is no movement of feather, means there is no respiration. Third is mirror test. Mirror is placed in front of nose and we have to look for fogging. Okay, you just remember the names and where they are used. Sometimes they can ask question, and so we have to be prepared. For circulation there are three tests: diaphanous, Magnus and Icart's. For respiration there are three tests: Winslow, then feather and mirror. Okay, moving forward. Now we need to learn about what are the changes which occurs in a body after death. Okay, so there are immediate changes, there are early changes, and there are late changes. So what are the immediate changes which occurs after death, just after death? First will be, as we have already studied, in somatic death there will be loss of brain function. There will be loss of brain function. Okay, so if there is loss of brain function, what what is the first sign we will see after death? It is loss of sensation and loss of voluntary powers. Okay, it is because of loss of brain function. Then there will be loss of respiration and circulation subsequently. Okay, so this is almost similar to somatic death, almost similar to somatic death. Okay, so what are the immediate changes of after death? First will be loss of brain function, which causes loss of sensation and voluntary powers. Then there will be loss of respiration, there will be loss of circulation. Now, what are the early signs which you will see after death? There will be skin changes, there will be eye changes, there will be algar mortis, there will be livor mortis, and there will be rigor mortis. Okay, so what are the early changes after death? The first change we'll see is loss of elasticity on skin. Okay, so skin changes we'll see. Then there will be eye changes. Then there will be algar mortis. Then there will be livor mortis. Then there will be rigor mortis. Okay, we'll see them elaborately in next slide. So what are the late changes which occurs? There will be decomposition changes. There will be putrefaction. There will be autolysis and mummification of the body. Now moving forward, what are the early changes? Early postmortem changes. Okay, so if we talk about skin, there will be loss of elasticity. Okay, after that there will be loss of elasticity of skin. Okay, this is the earliest sign which you will see. Next, eye changes. You will see some changes in various part of the eye. For example, in retina you will see fragmentation and trucking of blood vessels. Okay, fragmentation and trucking of blood vessels. So what I'll do, I will highlight the important points here. So fragmentation and trucking of blood vessels you will see. Okay, and how you will see? You will see by using ophthalmoscope. Okay, so as you can see here in this picture, there is fragmentation of blood vessels here. So this sign is very important, and it can come in your exam. This sign is known as Kevorkian sign. Okay, Kevorkian sign. It is also known as cattle trucking sign or railroading phenomena. Railroading phenomena. So what happens here is there will be fragmentation and segmentation of retinal blood vessels, and it will be seen within few minutes to 1 hour after death. Okay, so it will be seen within few minutes to 1 hour after death. So that's why it can be used to determine time since death. Okay, can be used to determine time since death. So this will be the earliest eye sign. Okay, if the question comes, what is the earliest sign after death, it will be different. But if the question comes, what is the earliest eye sign, then it will be Kevorkian sign. Okay, before Kevorkian sign, corneal reflexes and pupillary reflexes are lost. Then that means pupils will be dilated and there will be no corneal reflex. Okay, so again, in early sign, first will be skin, there will be loss of elasticity. Second will be eye. In eye, the first sign we'll see is fragmentation of retinal vessels. It is known as Kevorkian sign, and Kevorkian sign is seen within few minutes to 1 hour after death. Okay, these points you have to remember by heart. Okay, now moving forward, second sign. Second thing you will see is flaccidity of the eyeball. So, what is the normal ocular pressure? Normal intraocular pressure is 20 mmHg. Okay, just 2 hours after death, it will drop to 0. So, normal IOP is 20, and just 2 hours after that, it will come to 0 mmHg. Since the pressure will drop, there will be flaccidity of eyeball. Okay. So, since we know that flaccidity of eyeball will happen 2 hours after death, so can be used to determine time since death. Okay. Okay. Third is tachynory. Okay. This is also a very important sign, and it has been asked multiple times in the exam. So it is seen in sclera. So what happen is, after death, if the eyelids are open, okay, the dust will go in from the atmosphere and it will be deposited in the sclera. Okay, resulting in the formation of two brownish triangular shaped opacities. Two brownish triangular shaped opacities will be formed over sclera. Okay, over sclera. This will be known as tachynory. Okay. Now it occurs after 3 to 6 hours. Okay, and it is also used to determine time since death. Okay, it occurs 3 to 6 hours and it is also helps in determination of time since death. So till here we have seen Kevorkian sign. It was few minutes to 1 hour. Then flaccidity, it was 2 hours after death. Then comes tachynory, it occurs 3 to 6 hours after death. Okay, so see this photograph, this is tachynory. Can you see the triangular opacities over sclera? Brownish triangular opacities over sclera. It occurs due to deposition of dust particles since the eyelid remains open after death. Okay, now corneal change. So normally cornea is transparent, but after 1 hour it will become hazy. Okay, it will become, the haziness will be there, and after 6 hours the haziness will be converted to opacity. It will be completely opaque. It will be completely opaque. It will be completely opaque. Okay. Now, some changes in vitreous humor. So, it is the most important medium in the eye which resist decomposition or putrefaction, and at this point is very important, and it is a important question also. Vitreous humor is important medium in the eye. It resists putrefaction. It is the best medium for estimating time since death. Why? Because it resists putrefaction. So it is the best medium, and it is enclosed within the eyeball, which don't allow bacteria to have the access easily. What happen in vitreous humor is there is linear increase in potassium and hypoxanthine. Okay, there is a linear correlation with time since death of potassium and hypoxanthine both. So there are two formulas which you need to remember, which are used to determine time since death, is Stirner formula and Madia's formula. Okay, so what are the important point here is vitreous humor resists putrefaction. Vitreous humor is used to estimate time since death, and it is the best medium, and there will be linear increase in potassium, and the formula which are used to measure is Turner formula and Madia's formula. Okay, Stirner formula and Madia's formula. Okay, now moving forward, what is algar mortis? What is algar mortis? Algar mortis is cooling of the body. Okay, algar mortis will be seen within 15 minutes after death. Okay, after 15 minutes of death, the body will start to cool off. Okay, now BCT will decrease. Okay, body's core temperature will decrease. But how will you measure body's core temperature? You will use a thermometer known as thanatometer. Okay, thanatometer. It is a question, guys, and remember this. It is a question. Thanatometer is used to measure temperature. Okay, it is a chemical thermometer. Okay, it is a chemical thermometer. It is a chemical thermometer. It is a chemical thermometer. The size of the thermometer can vary from 25 to 30 centimeter, and it can measure temperature between 0 to 50 degrees Celsius. Okay, now what is the site, ideal site you use to measure the temperature? It is rectum. Okay, but in some cases, except in assault cases where anal penetration is there. Okay, means in sodomy, if the case is of sodomy, you will not use thermometer in rectum to measure the temperature. Okay, now what are the other site which are used to measure the temperature? It is the inferior surface of the liver. It is the inferior surface of the liver. Then external auditory meatus, nasal spaces, and the lower end of the esophagus. Okay, so the important points here is, what is algar mortis? Algar mortis is cooling of the body after death. It occurs within 15 minutes of death. Okay, and thanatometer is used to measure the temperature. Site is rectum. Other sites are lower surface or inferior surface of liver, lower end of esophagus, nasal spaces, and external auditory meatus. Now, as you can see here, this is the graph. So, algar mortis occurs in 3 stages. First stage is isothermic phase. Okay, there will be slow loss of heat from the body. Then second step is steep decline. There will be very fast cooling of the body, and there will be third stage will be there will be gradual decrease. Okay, so this makes the curve of algar mortis as sigmoid curve or inverted S shaped. Okay, inverted S shaped. So as I told you, algar mortis occurs in 3 phases. Okay, first is iso, second is rapid, third is gradual. Okay, shape of algar mortis curve is sigmoid. Okay, it will be sigmoid. Now, the important points here to remember are the rate of temperature fall is 0.4 degrees Celsius to 0.7 degrees Celsius per hour. It is a question. It is a question. Okay. In summers, it is 0.4 degrees Celsius per hour, and in winters it is 0.7 degree Celsius per hour. Okay. If we know this rate of fall, we can calculate time since death easily. So this is also used to know time since death, determine time since death. Okay. So important point here to remember: within 15 minutes, thanatometer, rectum, inferior surface of liver, nasal spaces, lower end of esophagus, and external auditory meatus. The graph will be inverted as or sigmoid shaped. There will be three phases: isothermic phase, then rapid, then gradual. Rate of fall of temperature is 0.4 to 0.7, 0.4 in summer, 0.7 in winters. Simple. Okay. Now, what is postmortem caloricity? What is postmortem caloricity? Normally, what happens just after death, within 15 minutes, the body starts to cool. Okay. Means algar mortis will set up. But if the body remains warm for 1 to 2 hours even after death, this phenomena is known as postmortem caloricity. Okay. Normally, body will cool after death, but if it remains warm even after 1 to 2 hours of death, this is known as postmortem caloricity. Okay. Whenever there is increased in body core temperature at the time of death, postmortem caloricity is seen. Now, increased, what are the uh, conditions in which there will be increased body temperature? So body temperature will increase due to increase in muscle contraction, like in due to tetanus and strychnine. Okay, the two poisons uh, which creates this condition, okay, is tetanus and strychnine. I mean, two conditions which can cause PM caloricity is tetanus and strychnine poisoning. Okay. Now, failure of thermoregulation, okay, will also cause PM caloricity. Then heat stroke, pontine hemorrhage will cause caloricity, and septicemia will cause caloricity. Now, an important point to remember here is heat stroke will cause PM caloricity, but burns will not show PM caloricity. Okay. Heat stroke is responsible for postmortem caloricity, but burns is not. Please remember this, it is a question. So, what are the conditions where PM caloricity is seen? Remember, septicemia. Okay, infection in the body. If a person is the cause of death of a person is septic shock or septicemia, there will be PM caloricity. Body will remain warm even after 1 to 2 hours of death. Second, failure of what? Thermoregulation. If the center which controls the temperature or regulates the temperature of our body, what is that center? It is hypothalamus. If there is a failure of hypothalamus, then also you will see PM caloricity. Third one is heat stroke. Fourth is tetanus. Fifth is strychnine poisoning. Okay, remember these 4-5 things. Okay, and we are moving forward now. Now, what is PM staining? What is postmortem staining? It has many names and you have to remember all of them, because question may be asked by using any of the names. And sometimes in exam, uh, if the if PM staining is there in the question, we will be comfortable and we know what PM staining is. But if they use a different name like hypostasis, sometimes like hypostasis or lever mortis or vibsys or sigillation, we get confused. Okay, so PM staining or PM lividity is also known as hypostasis. It is also known as lever mortis, vibsys and sigillation. So remember, hypostasis, lever mortis, vibsys and sigillation. So what is PM staining is, the stains will be present in the dependent part of the body. Okay, that is area that do not touch the ground but face towards the ground. Basically it is present on the dependent part of the body, the area which will touch the ground. Okay, and why is there PM lividity? Why there is hypostasis? It is because of the gravitational force. What they will do, they'll cause blood to pool in the capillaries and venules, accumulating deoxyhemoglobin in the skin. Okay, causing a bluish purple appearance. So what is the appearance of PM lividity? Is bluish purple appearance. It will look bluish purple. Okay, there is also skin discoloration of rete mucosum of the dermis. So what are the important points here? It is due to gravitational force, due to pooling of blood in capillaries and venules, which accumulates deoxyhemoglobin blood. So gravitational force and deoxyhemoglobin blood is responsible for PM lividity. And what is the color? The color is bluish purple. Okay, bluish purple. So PM lividity is also known as hypostasis. It is also known as lever mortis. It is also known as vibsys, and it is also known as sigillation. Okay, it is due to the gravitational force. The blood pools into the capillaries as there is no circulation. So now only one force will come into action. What is that? Gravitational force. Whole blood will come into capillaries, then into venules, and there will be accumulation of deoxyhemoglobin in the skin, which will change the color of skin to bluish purple discoloration. Okay. Now it will start as soon as death is occur, and it is visible in 2 hours of death, and maximum visibility will be in 6 to 12 hours, and fixation occurs after 7 to 8 hours. So PM lividity will start after 30 minutes of death, and it will be visible on the body in 2 hours, and fixation will be in 7 to 8 hours. Okay, what is fixation? Fixation is when it will be PM lividity will be fixed. Okay, if you put pressure on the part where you see the discoloration on the skin, it will not go off. Okay,